Home healthcare workers face many unique challenges not seen in other medical professions.
In the interest of time, we're only going to be talking to you about two of these topics.
I'm Dustin, and I'm going to talk to you about pets.
And I'm Jonah, and I'm going to be talking to you about pests.
While people are known to keep many different types of pets, rabbits, snakes, tigers, rocks, etc., the pets you are by and large most likely to encounter during an in-home visit are, of course, cats and dogs. The American Pet Product Association estimates that around 65% of American households have either a cat or a dog. The ideal situation would be that you could communicate with patients ahead of time, know about the pets, and they will put them away before you arrive. Oftentimes this won't be the case. In some instances, you may be surprised by an animal upon a first visit, and maybe the patient won't agree to put the pet into another room. Not everyone is equally adept when interacting with these animals, so I'm going to give you some tips for the next time you encounter them on the job. Now, cats are much less likely to approach or demonstrate protective, defensive behavior. So between cats and dogs will be the primary focus from here. Interacting with dogs. Here are some general rules of thumb for interacting with a new canine acquaintance. Don't stare a dog in the eyes. Don't lean over a dog or squat down right in front of its face. If you wish to offer a dog your hand to be smelled, never offer the palm of your hand. Offer the back of your hand. If the dog does seem receptive to being touched, a safe bet is to reach in from the side and pet the neck. Dog body language. Every dog is different. They come in many different sizes and with many different temperaments, but they tend to show their emotions in similar ways. It's important to be perceptive to the body language that dogs give off and to adjust accordingly. While growling and barking may be obvious signs of an unsettled dog, you may have to identify uneasiness with more subtle signals. A dog with raised hair along the spine and an intense stare may be dangerous as well. It's important to make a dog comfortable. It's a great idea to keep dog treats handy for situations like these. With the owner's permission, drop a treat on the floor in front of the dog. There's no need to become best friends with the patient's dog. It's just important that they're comfortable and don't see you as a threat. Even when they're friendly, cats and dogs can present trip hazards and can be distractions, so it's best if they can be kept in the next room.
Pests in people's home can range anywhere from rodents, such as mice and rats, to insects, such as cockroaches and bedbugs, all of which pose a serious problem for home healthcare workers. Bedbugs have proven to be a growing infestation problem in the last few years, which comes with a take-home risk for home healthcare workers. Workers need to be bedbug conscious if they are to avoid transporting them in their cars, taking them to the office, or even taking bedbugs home with them. If you are preparing for a home visit, avoid wearing shirts with buttons and pockets. Avoid cargo pants or pants with cuffs. Simple shoes that can be thrown in a hot dryer and that have minimal tread are also recommended. Do not accessorize with anything, particularly scarves, jewelry, or handbags. It is useful to contact the client prior to the first home visit and ask them if they've had any insect infestation or pest control treatment within the last 2 to 3 months. Bringing up the subject of bed bugs to clients can be a delicate matter, regardless of whether your client is an elderly widow or a retired vet. Approach the subject in a considerate manner, as if bed bugs are the most common thing in the world. If bed bugs have been a problem in that home, you can take precautions to protect yourself. After you arrive, simple protective clothing will also protect you if you know that you will be moving or carrying items like a wheelchair from an infested home. This clothing should also be worn if you are physically moving people or animals from an infested home. Do not sit on upholstered furniture or the bed. Take a quick look in the cracks of hard chairs before sitting down, or better still, bring your own chair when you visit. Carry only those items with you that are essential to the home visit. Leave everything else in the car. A plastic clipboard can be used to hold your paperwork. A fanny pack can be used to hold your wallet, personal items, and spare gloves. Avoid placing anything on upholstered furniture, bedding, or carpeted floors. If you are repeatedly visiting infested homes, put together a bedbug contamination kit for these visits. The kit could include items such as a portable hard surface chair or stool, a fanny pack for holding personal items like your identification, cell phone, and additional gloves, a change of clothes and shoes, a plastic storage container with a sealed lid or sealed garbage bag that is large enough to contain the items you need to take with you on the job. If you have contacted bed bugs, once you return home, remove all clothing before entering the home if possible, or in the bathroom if not. Immediately place your clothing in a sealed plastic bag. Get into the shower. After showering, collect your sealed items and place them in the washer with hot soapy water. Place shoes in a hot dryer for 30 minutes, and dry your clothes on high heat.
It's important to be ready for anything during an in-home visit.
Hopefully this video has left you feeling more prepared for run-ins with animals and unwanted pests.
We wish you the best out in the field.